So there was a big bust in Saskatoon. So there's a Saskatoon pharmacy with 24,000 oxycodone pills missing. And that made the news. And it definitely shines some light on how drug inventories are tracked in Saskatchewan. So, naturally, we brought in our friend, Dr. Barb Fornssler. And Donna's here as well. And we're going to talk about these things. Hello, ladies.
Hello.
Hello,
I'm just
hello.
gonna disclaimer myself at the outset that this is in no way me commenting on an ongoing and active investigation that the police services are undertaking, and so I'm really here to offer comment on some of the substances that are seized and different regulatory mechanisms more than anything, and that's how I keep my job. So,
Donna, you came across this somehow. How did you first learn of this, and what were your initial thoughts?
This was a pretty big headline that caught my eye, of obviously being a local event. And I think it's why it kind of gripped the community, is because, we don't often hear of pharmacists involved in something like this. And I think we'll talk a little bit about why.
We don't often hear of pharmacists getting caught.
Well, okay. And that actually segues into the why and what Barb had alluded to about the mechanisms that are in place. With my limited understanding of pharmaceutical practices, it was like cashing in and out every day. Like when you're operating a till, you cash your till in. At the end of the day, you cash your till out, and if it doesn't balance, you've got to answer. And so I assumed that that was the case with pharmacies, and Barb basically confirmed that there are those sorts of checks and balances. So to prevent this very sort of thing from taking place. So I was a little bit surprised that, 24,000 pills went missing in a, 4 or 5 month period?
Well, wouldn't the pharmacist, the accused pharmacist, is also the owner of the pharmacy, correct?
That is my understanding. I could be wrong on that. I know that the permit for the pharmacy itself has been revoked, and the accused pharmacist has been put under suspension.
Barb, what was your initial thoughts when we brought this to your attention? I remember we were I reached out to you, I'm like, Barb, we need to do an op-ed about the Saskatoon pharmacist, and you're like, what? And then 10 minutes later, she's like, oh my God, I didn't even hear about this.
Yes. Well, and it's exactly, I'd been off doing researchery things and hadn't read the news sort of thing, and was very curious about how this had unfolded according to the news media reports, and really, like, with all kinds of regulation, whether it's prescription monitoring and review programs or other regulatory mechanisms in place around pharmacies, and this is not my expert field of policy by any means, but it seems consistent across all regulatory mechanisms that a lot of our regulation depend on the honest reporting from people who are delivering services. We don't often have the resources to send people in to go investigate. It's kind of like at a restaurant, right, where if somebody gets shut down for poor food handling practices, it's often months of poor food handling practices before that gets, before complaints are lodged or somebody notices that, hey, this isn't up to par. So I think we've got a similar situation when it comes to regulating controlled substances.
But this happened over a relatively short period. Like, it was from like September 22 to January 23, right?
Yeah.
So it wasn't like this went on for years or anything.
No, kind of suggests to me that they were reporting balanced inventory until such times as that initial bust happened. Was that January 9th, I think it was, where the initial bust was made of three men. And then somehow it led back to the pharmacist. I think they were found with like pharmaceutical grade oxycodone. So then obviously somebody said, well, we got it from this person. And so then that, kind of springboarded the investigation into the records of the pharmacy.
And I mean, I think that speaks to the drug toxicity situation as well, where when they find, a product that isn't contaminated with fentanyl, that is actually produced by a pharmaceutical company, that they're like, hey, wait a minute, there's no way this could be here without some kind of leak in the system, in a sense.
Yeah.
And yeah, in some ways, this regulatory mechanism did work because it was identified in a relatively short period of time. Could we accelerate that in the future? Probably, as we learn and go forward in sort of how to better regulate these substances. I think we're going to see improvements in these regulatory programs. And I'm sure that this case in itself will help inform those next steps and close any loopholes that they identify that were maybe exploited for this purpose. A really interesting aspect was the pharmaceutical products that were identified, at least in the news media reporting, are also often used as a substitution therapy approach for people accessing treatment, or sometimes can be used as a safer supply option for those who are seeking to avoid the toxicity crisis.
That is really interesting, considering, as you also aptly pointed out, the amount of the illicit supply that was found.
So it wasn't just revealed that there was legit pills missing. There was also a pile of illicit substances there too. And thanks to the Saskatoon Police Services, we have this image. Ta-da! So what substances are we looking at here now? So
20 kilograms of methamphetamine.
Well, and I'm sure that, how do I put it, in a drug market that is as toxic on the illicit side as it is, that regulated product, and that's really, I think, the dividing line in the pharmaceutical industry, and sort of what we get at pharmacies is a highly regulated supply of substances that help address pain management, that help us address all kinds of health concerns. Those are important things to have. Fentanyl, for instance, is used a lot after surgery and in various situations medically. But when it flips out of that regulated framework into an illicit market, and that's basically what makes it illicit, there's no regulation around it. The risk of harm, the risk of taking it in a way that maybe wouldn't be recommended by a healthcare provider, those risks all increase. And yes, with the growing understanding of the toxic supply, the presence of fentanyl or carfentanil and other harmful substances that can cause a lot of harm when you don't know that you're taking it, so you can't control the amount that you're taking. That risk of death and extra harm just skyrockets. So when we leave that regulated environment, it's just not really predictable. So I can see in this context then a regulated product that isn't going to cause immediate death because you can control the dose would become very valuable and attractive to the illicit market in that context. And basically, at the end of the day, I think it scares people, especially when we see news stories like this and, giant packages of drugs, on display. It is scary, nobody wants that, like that. That's scary. There's a firearm there. For those who aren't in Canada, we don't see handguns hanging out very often in this country. And so that kind of thing, I think it's right for people in our community to be concerned about the potential for violence, about the potential for additional harm.
What do you think this event is going to do for the community opinion around the trust we have or don't have in our service providers?
I think a lot of folks will perceive it as a breach of trust. There's a reason that health professionals who work in pharmacy environments are licensed. And at the end of the day, if you're not willing to practice under that environment, then you can't work in that job. And that's really where the role of regulation for me kicks in. And sort of, we have often a punitive response when those regulatory guidelines aren't followed. So it's a huge conversation in a sense. And I think probably what cases like this communicate to the public are, be fearful of drugs. But unfortunately, that fear drives ideas around the war on drugs and that we can arrest our way out of this situation. Right. Unfortunately, we can't. And it really is those regulatory mechanisms and the professional bodies that keep communities safe.
I think because of those regulatory mechanisms, it's a little bit surprising that a pharmacist would risk so much.
Yes.
For this kind of a venture, if you will. Say myself, if I'm doing some beanies or even a bank robbery where I'm all masked up and shit, I've got a pretty good chance of getting away with it, unless I, talk and whatever. But with this is literally a matter of time. This isn't just a losing your license. This woman is facing some serious jail time.
Yeah. Well, and I guess I think that's maybe that's the distinction here in policy. We've got like legal policy and regulatory policy. And our legal policy is reactive, right? Something bad happens and we react and we penalize through the law and through legal mechanisms. And what regulation and regulatory frameworks should do is sort of set that proactive environment, right? So this is how we're going to govern things to keep people safe. This is the policy around that. And that proactive approach often goes a lot further for community safety than the reactive approach. Cases like this can really inform what does proactive regulation look like, and how do we sort of set up this environment so that everyone is well protected and successful in their medical careers. As patients, we're able to access what we need, and the community is protected from harm as well. Substances still get into prisons, and prisons are the most regulated, highly secured environments in our society. I don't think we want a prison surrounding all of our society. And even if we built that, it's still not going to work. You know what I mean? Like at the end of the day, we're still going to see substances. So the question isn't so much like, can we stop drugs as okay, we know drugs are going to be there. So how do we set up an environment where those drugs cause as little harm as possible to individuals who use those drugs and to their family and community around them? And that's the kind of proactive regulatory framework I'd love to see happen. And and it might prevent future things like this from happening, where you know there's no incentive to divert from a pharmacy, and there's no incentive to go to the illicit market. So
interestingly, on that point, like almost simultaneous to having come across that article, and I stumbled onto another article about Dr. Tam, Chief Medical Officer of Canada. She is on board with regulated supply. Now, if we could just get the provinces
other than BC,
yes.
to acknowledge the evidence.
Totally. And that's basically it. I think we've got a major divide right now in society because basically not everyone like me, you know, I get to spend my day job is to study this topic in depth, to learn the policies, to see the study. Like I get all this information access, and that's my job in the world. Part of my job too is like I got to share that evidence with other people so that they understand. You know, as I often say, if the only thing I ever saw about drug use was Fear and Loathing in Las Vegas, damn right I'm going to be terrified. You know, like,
that's funny. After I saw Fear and Loathing, I was like, where can I get some of that shit?
Right?
So okay, there are going to be some advocates out there that are going to see that and say, oh, good, some regulated supply made its way to the streets. That's good. At least those people aren't using a toxic supply. Do you think that in some way this might have been a productive vessel to get some of that regulated supply out to the street?
Like long-term prevention wise, would I love to see, you know, happier, healthier communities that aren't necessarily needing substances to feel good? Yes. And it is to me, it speaks to a failure in our regulatory frameworks and in our social response to substance use that people are pushed into these positions of making, you know, terrible choices. So the more we stigmatize substance use, the more likely it is that people are going to stay away from health regulatory channels. They're not going to talk to their doctor or pharmacist, and they're not going to have the supports to use the substances that they need as safely as possible until such time as they might desire to not use that substance, sort of thing. And that's a really individual question and journey, and certainly not something for me to like tell people when they should heal, not at all. But I do want people to have the opportunity to embrace recovery, whatever that means for them, because they're not dead from a toxic supply.
So what are you hoping to learn as this investigation moves forward? I mean, personally for me, I'm really interested in why. What is the why here? Why did these people, particularly the pharmacist with so much to lose, knowing full well that this is a ticking time bomb, I'm going to get caught. Was there coercion involved? Was there substance use challenges involved?
Yeah, I really hope to have a fuller understanding of sort of what happened here, and to hear more from the folks involved. We tend to sort of ignore the voices of those who are criminalized or charged criminally. But I think that'll help share a fuller picture than the picture of the drugs on the table that we see that we see in the reporting, in a sense. They're exactly the concerns that you mentioned, Dan, around, coercion, around that person's safety, around potentially their own use, and around the economic incentive of moving things through an illicit market. All of those factors could be playing a role. It's all speculation in a sense at this point, but I am really curious. I'm also curious about what we'll learn about our regulatory mechanisms, in terms of pharmacy practice and stuff.
And tracking, like that's the title
yes.
of the article I'm looking at, is it's shining light on inventory tracking.
Yes, right.
So,
and these sorts of things. So I'm hoping that we can improve those practices, and that'll help set the groundwork for a more regulated framework to meet the needs of people who use drugs in our community, so that they're not exposed to that toxic illicit market in a sense. And so, in a sense, I hope it's seen as a learning opportunity more than anything, rather than
However, I hope that the pendulum doesn't swing too far.
Yes.
And it becomes almost impossible for a pharmacist to do their job, or without a mountain of paperwork to do. Like, I'm a little bit concerned, given the climate of our current administration, that this is gonna I don't know.
And we don't want to, how do I put it? We also don't want to enact sort of reactionary policy. I talk about sort of lobbying reactionary policy, but sometimes, when the public gets really panicked about something, sometimes we'll see a reactionary policy that is actually a huge barrier to care come into place. And that's often based in just having a partial picture. I saw a table full of drugs
and
stigma. I'm really scared, and stigma and sort of that
additional costs to the voting or to the tax-paying public.
100%, right? And so figuring out how to effectively prevent this from happening in the future is important. And I think also recognizing that thousands of pharmacies across Saskatchewan provide various substances to people in need, for medical need, all over the place. Every day this happens, and it's been really quite successful in a sense in terms of the regulatory environment we have now. We're not hearing about this happening every week. This isn't a regular occurrence, which is probably why it made the news, because it's unique, right? They often say in journalism, dog bites man, not a story. Man bites dog, that's a story. And so, so that's, when we flip it. So in a sense, this is not common in the world of pharmacy to have this kind of missing inventory reported and things like that. So in some ways, we might be able to say, hey, 98% of the time, this system of regulation is working well and people are compliant with it. And we can close these loopholes here, but overall, we're not seeing this on the daily in Saskatchewan or really anywhere in the country. And so part of the reason I think it gets reported is because it's novel. It's a different kind of thing that we don't see that often. We'll close those loopholes, I'm sure, as professional bodies always do, as professionals, try to keep their profession in alignment with community safety, with community needs, all that good stuff. And I hope it doesn't lead to too much more stigma in the community, out of that fear-based response that I think folks who are maybe not part of this conversation on the regular rightly have when they see these kinds of stories in the news. Everybody says, I don't want my kid using drugs, and it's like, yeah, absolutely not. But how do I put it? We often can't choose whether the people in our lives are going to use drugs or not. What we can choose is whether those drugs come from a regulated source or an illicit source. So
and it's very likely that this is a driver of occurrences like this, is that the illicit market is so much more appealing, so much more low barrier, that it makes stuff like this more feasible or worthwhile. Now, maybe this person's end game was a one-way flight to Ibiza at the last moment. And she just didn't get on the plane quick enough.
Right. You never know sort of what the underlying motives or what the backstory is that's going on there.
Because there had to be an awareness that this was not going to come to a good end. People are going to find out.
Yeah.
We mislead ourselves a lot in the world of substance use, I think, when it comes to when it comes to
How slick we
deceiving,
are.
Yeah, and I think Donna and I can both speak to that. Now, if this does come to a
Yep.
place of substance use challenges and trying to support that, I can certainly speak to that. I did all sorts of payday loan scams. I did all sorts of other things. I'm not going to out Donna, but she's shaking her head like, yeah.
Yeah, and I mean, at
So-
the end of the day, if you could have gone into your doctor and said, "Hey, I need this substance to not get
Oh,
sick," and they could give
100%.
it to you, none of that
100%.
additional community harm
Yeah.
would have come to be, sort of thing. And
That is a
and
topic
that's-
for another show.
yes, yes, it is. It's a really interesting case. No, and I'm glad for the opportunity to talk about it a little bit more and try and unpack some of the reporting that we see and
Mhm.
and sort of the way that shapes public perception is often fear-based. And I think saying, hey, let's pause our fear for a sec and get a little bit deeper into this conversation, it gets a little less scary in that sense, because we can see that sometimes, that most of the time, our regulatory mechanisms are working, because we don't see this happening with pharmacies on the regular, and that there was a response that was relatively quick when it was happening. So yeah, we'll close those additional loopholes. But overall, to me, I'm like, the message to the community maybe shouldn't be fear-based, but should be like, hey, regulation's working to some degree, and we've got some things to fix here, but it's actually not happening every day. So that's a good news story.
Yeah.
Sort of like the motives, really.
So and as we learn more, certainly we will be making more content to bring to our subscribers on our YouTube channel. So if you're not subscribing, subscribe right now. We go live twice a week, Tuesday nights, Sunday nights, talking about stories of lived experience. We talk about advocacy, research, Barb things, and yeah, I guess we'll cap it there. Thanks so much, everyone.
Awesome. Thanks for having me on, Dan.
All right.
And Donna.